Hi everyone, my name's Christy West. I'm the High Priestess of Narration. Do we have any patient volunteers as tribute?
I volunteer as tribute.
We have Mackenzie Jones. Next up, we have Master Clinician Chandler Newbold.
That's me.
Coming in hot, we have the CEO of McNally Productions.
Oh yeah.
All right, next step up, patient readiness. We are going to lay our patient back, make sure they have proper eyewear, a nice sized plastic plied bib, and we're going to ensure our master clinician wears all proper PPE. We have eyewear. We have a mask. And we have gloves. All right, everyone. Step 2. We are going to discuss gingival index. Abbreviation for that, GI. What is gingival index? It is to assess the severity of gingival bleeding. Gingival bleeding is also called gingivitis. How do we measure gingival index? You are going to do a very gentle, light walking with the probe. You are going to measure 4 points. One on the straight facial, one on the straight lingual, one on the mesial, and one on the distal. The mesial distal will be located in the caul area. When probing, you will also assess 3 other things: the color of the gingival tissue, the consistency, and all bleeding points.
To take a gingival index, you may do it on one tooth, multiple tooth, or all teeth. So to begin, you're going to insert the perioprobe into the gingival sulcus about 1 to 2 millimeters. Then you'll press gently but firmly against the gingiva. To determine the firmness, move the probe circumferentially using a horizontal stroke. We're going to do distal to mesial. Then you will assess bleeding and tissue appearance in the pocket and record your scoring. Starting on the distal of number 31, we're going to record the scoring for each tooth. 2, 2, 1, 2, 2, 0, 2, 2, 2, 2, 0, 2. Now we're going to record on the lingual. 2, 2, 2, 2.
You're all probably wondering what the numbers meant that our master clinician was reading out. They go in 4 different topics, which are either points or called a grade of 0 to 3. You will also note the appearance and the sulcular bleeding, as well as inflammation. The point or grade with 0 will be an appearance that is normal, gingival tissues that are pink and firm, sulcular bleeding will not be present, and there will be no inflammation. The next point or grade is 1. The appearance will have a slight color and change. The sulcular bleeding will not be present, and inflammation may be mild. The next point or grade would be 2. The appearance will have redness, hypertrophy, which is also hyperplasia, swelling of the gingival tissues, edema, which is also redness and swelling, and glazing. Bleeding upon probing will be present with grade 2. Inflammation will be moderate. For point or grade 3, your appearance will be also red. Hypertrophy will also be present, which is hyperplasia, swelling of the gingiva. Edema. The difference between 2 and 3 is that 3 will have ulcerations. The sulcular bleeding is spontaneous, may or may not be present, and the inflammation will be severe. After you gather your data on all 4 points, you will then go into scoring, and I'm going to teach you how to do so. So first, our master clinician collected a 2 on the distal, a 2 on the facial, a 2 on the lingual, and a 1 on the mesial. So to calculate for the single tooth, you're going to take all points and add them together. 2 plus 2 plus 2 plus 1 is 7. You will then divide the 7 by 4. This will divide into 1, 3, so, like I was saying, the 4 goes into the 7 one time. You have 3 left over. Add your decimal, bring your 0 down. 4 into 28 is 7. 28 subtracted from 30, you get a 2, bring a 0 down. 4 into 20 is going to be 5, so you have 1.75. Your scoring is going to be either a 0, a 1, a 2, or a 3. So you have 1.75. We are going to round to a 2. The score for this one single tooth on number 31 will be a 2. If we're going to look at multiple teeth, we have, again, she probed 31, 30, 29, 28. I have pre-done the math to just make this go a little quicker. For 31, we have a total of 7. For 30, we have a total of 6. 29, we have a total of 8. 28, we have a total of 6. So from here, we're going to add all of these numbers. 7 plus 6 plus 8 plus 6, which will give us 27. Then you're going to take your 4 teeth and your 4 surfaces, which will be 16. So we have 27 points divided by 16, which is going to give us 1.68, which we will round to the score of 2.
And now for our myth buster of the day.
Is brushing with hydrogen peroxide and sodium bicarbonate paste as effective as brushing with fluoride toothpaste in reducing gingival inflammation and bleeding with patients with periodontitis? The answer is no. Hydrogen peroxide and sodium bicarbonate toothpaste are more effective with patients with periodontitis than toothpaste with fluoride. And the reason is because those hydrogen peroxide and sodium bicarbonate toothpaste are more geared towards those periodontitis patients in aiding in inflammation and bleeding, whereas our fluoride toothpaste is more for preventative care and in closing tubules and preventing decay.
1 recording.
What's your gingival index? What's your gingival index?